Rise Wellness, Wise Wellness, what? Wednesday Wellness.
If you're not making a lot of it today.
We have a guest we promised from last week, right?
Yeah.
Week, yeah. And Maureen O'Keefe.
O'Keefe, yep.
Maureen O'Keefe from Purple Mountain Physical Therapy.
That's right.
Yeah. I see her personally. I talk about her all the time. We send everyone there. So we have her here talking about pelvic floor health. The five, not five, just red flags.
Various red flags. So you might know that you have pelvic floor dysfunction.
Yes.
So this
If,
is fun.
Yeah, or if most people do. Probably.
Yeah, unfortunately, a lot of us have troubles with it, whether you're a woman or a man.
Woman or man, which I didn't realize that.
Yeah, the
you
men
saw
have it.
Yeah, until I saw you and we just chatted about it. But.
And actually, I brought my little graphic. So these are the woman's pelvic floor muscles, and then I'll show you. Here's the men's. They look the same, don't they?
Yeah.
So a woman, obviously, we have two places of entry or exit.
I'm gonna tell you something. People don't know that. Not even women.
Know what?
That they have two entries. I was I was following someone on Instagram, and they were like, "Oh, I didn't even know there was a separate hole, like your urethra and your they didn't know."
Oh yeah.
So there we go. In case you didn't know.
Yeah, there is.
Anatomy 101. Yeah.
First one. So for women, we have this place where we insert our tampons and other things, and then this would be where we would have our bowel movements. For men, they only have the place where the bowel movements come out. And all of the colored stuff are your pelvic floor muscles, and everything white are the bones that the pelvic floor muscles attach to. So they attach to your pelvic bones. And when they're tense or tight or asymmetric, left side to right side, it will pull your coccyx, your tailbone over, or your SI joint over, or it can pull the front area over and around. And that can lead to a variety of problems. So a lot of my patients will have chronic tailbone pain or SI joint pain that won't go away, or back pain, or other things. So to give you...
Yeah, I started seeing you because I was 4 years postpartum.
Well, you had twins. She had the twins.
4 years postpartum. And
you have a pelvis.
I get adjusted regularly, and I was still having some low back issues. I was also, diastasis and other things going on. But I was like, okay, there's got to be some pelvic floor stuff going on here. So I hit up Maureen.
Yeah.
Yeah.
Well, when you have twins or you have a pregnancy, even if you have an elective cesarean, the pregnancy itself kind of changes and strains the pelvic floor. And for some of us, we're left with dysfunction or problems ongoing afterwards.
Right.
So that's where I come in.
Yeah, because I didn't have the I'm peeing my pants when I'm doing jumping jacks. Oh, I can't pee. Oh, this so I didn't think I had a pelvic floor issue. But like I said, I had hip pain, and I had these other things that weren't clearing up. Or I did have frequency, which I didn't really think was an issue, but then you kind of learn, oh wait, that is an issue.
Right.
Pelvic floor.
Right. So the frequency is an issue of the pelvic floor. And then diastasis recti, abdominis, where the abdominal walls, you should have a six-pack that's somewhat tight together
Everyone should have a six-pack.
along your abdomen. It's actually an 8-pack. It kind of runs like this, but it separates in order to naturally accommodate the baby, the growing babies. And then postpartum, it should come back together. But for some of us, it doesn't come back together with full integrity. And there is fascial connections between that rectus abdominis near the pubic bone. So the lower abdomen has fascial connections with these muscles here of the pelvic floor that help you control your pee. So if you have a diastasis recti, it can throw off pee stuff. You can have urinary frequency or urgency, or you can have your stream stops and starts, or you just leak urine. Any number of troubles with peeing.
Yeah, because I feel like most women are postpartum are oh yeah, I just pee my pants, right? That's just what it is. And that's probably the most common, I would say, when people come see you. But like I said, there's other reasons why.
Yeah.
Especially in here, if we're seeing people and I'm okay, your SI, your low back is not clearing up, you're still having, I'm you need to go get pelvic floor help.
Right.
Yeah.
Yes.
Right.
So I just had a woman that we just finished her plan of care. She's all finished, and she has no pain, but she had 7 years of pain since her pregnancy.
Right.
And she works out every morning, hardcore. She's doing 110-pound deadlifts like you guys do.
Do I know this person?
Maybe.
I don't know that you know.
Oh,
her.
she doesn't mind.
I'm not sure. I don't know. You didn't say.
Okay,
I feel like this is the story.
I thought it was a different. Yeah. I'm
yeah.
yeah.
Wait a a minute.
all these postpartum moms like trying to work out, trying to like
Get their body back.
core and get their body back.
Yeah.
And not properly.
Not properly, and then they're injuring themselves. They're injuring their low back or their pelvis because they don't have the core strength and they don't have like the pelvic floor stability.
Or they
Or
don't
the
have the
breathing.
coordination.
Yes.
Yeah.
Or the breathing.
Mm-hmm.
I had a breathing issue.
Yeah. Yeah. Because the pelvic floor is the bottom of the core, the diaphragm is the top of the core, and the abdominal wall is the front of the core, and then your back muscles are the back.
Mm-hmm.
So if your diaphragm isn't working well, your pelvic floor is screwed up. So if you can't diaphragmatically breathe effectively, your pelvic floor is screwed up. Because they work together in coordination, ideally. So you're speaking to these women at the gym who are somewhat injuring themselves, and they tend to be, sometimes they're actually in shape.
Right.
Oh,
And so it's not like they're weak. What is happening often is there's this discoordination where the muscles are firing at the wrong time, or the wrong muscles are firing, and then they think they're okay and they can work out until they're not. Then they throw off their back and they're coming to you guys, or they're like, man, my SI joint problem came back again.
Yes.
So this lady had a variety of care over 7 years. It was very frustrating, really frustrating. With this SI joint pain that would always come back, and somebody had sent her to a pelvic PT, and she went and she got an exam, and that person said, oh, your pelvic floor is fine, let's really focus on your hips. But her pelvic floor wasn't
She
fine.
had a really tight pelvic floor.
She did, yeah. So then she came to me, and I'm checking these muscles here in the vaginal area, and they go back and they attach to the coccyx, and they're like super duper tense in her case. And in a lot of you who are watching this, you would have that and you wouldn't know it.
Yeah. You don't know it until Maureen hits it, and then
you're like, there it is.
Yeah. You're like, oh, that is like where it is, but my pain. I'm like, wow. So yeah.
Yeah. Yeah. And like I have another person right now who has terrible right groin pain from a bad hip. She legitimately has like arthritis in her hips, and so the textbook presentation of that would be the groin pain, like right here.
Okay.
So she does have that. But then when I checked her out, she had a different muscle. This is a hip muscle called your obturator internus.
Your favorite muscle, right?
Yeah, I love obturator. It's my favorite. If you look at it anatomically, 3-dimensionally, it's so cool. Because it's inside the pelvis and it jumps out of the pelvis. It's really cute. But anyhow, her obturator internus, this is somebody who has terrible arthritis in her hip and needs a hip replacement. It turns out her obturator internus reproduces. If I touch that muscle, I completely reproduce her pain.
Right.
So then that's telling you, well, that the joint itself is not responsible for all of her pain.
Right.
Yeah. Or like maybe that muscle dysfunction contributed to.
Yes.
Yeah.
Yeah. And if you go and have a hip replacement on a bad obturator, you're not going to have great stability and optimal balance of the muscles and the stability in that joint.
Right.
So we've got to refresh that situation.
What happened with the other lady? Did you just get that muscle to relax?
Oh yeah, so for her, for the other lady with the 7 years of SI joint pain, who's super fit, like CrossFit type person, we worked a ton on down training her pelvic floor, which meant we need to learn how to get it to relax and open.
I never even knew that was a thing until someone told me breathe into your pelvic floor.
Yeah.
I mean, if we learn about pelvic floor at all, it's like Kegels. And it's like strength and strength.
I know. If I could say anything, here's my takeaway: stop doing Kegels. For real. So the pelvic floor function naturally is that it works automatically. So I talk to my patients also about there's automaticity that should be happening with your pelvic floor. For example, any of us who can walk around today and not pee or poop our pants when we just walk around, we have that automaticity happening. So it's automatically happening without you thinking about it. You don't have to walk around and do Kegels to hold in your pee or poop. And we've been given this message incorrectly of you need to do your Kegels, do your Kegels.
Freaking Cosmo magazine.
Yeah, it is! It's so true. Get the best of your life. You gotta do a million of these. Then they come to me and they are so tight they can't have the big O because that does involve a nice movement of the pelvic floor. So if you're too tight, you don't get that.
Would you say most people have a tight pelvic floor, not a weak one?
We see more tight.
Which is also mind blowing to me when it first you just assume everyone's I have this weak pelvic floor. I was like, I doubt you do.
Yeah.
I'm like, I doubt you do.
Yeah. So a tight pelvic floor is what I call that is high tone.
High tone, yeah.
They have like high tone pelvic floor, and that type of a pelvic floor is in and of itself somewhat weak because they don't have the muscle length to give you like a good pull.
Right, you can't like link.
So there is weakness in there, but if you do a bunch of Kegels to tighten up something that's tight, you worsen the problem.
Right.
So you've got to work on this lengthening situation.
Mm-hmm.
And also some other symptoms of the pelvic floor dysfunction, because it controls bladder, bowel, and intimacy, or it influences those things, and it influences holding up your organs. So for a woman in particular, because we have the two outlets, you may have heard of a pelvic organ prolapse, where some of the organs that are held up in part by the pelvic floor hammock of the muscles, some of those organs can descend, and we might feel pressure or mostly it's like pressure that's down, usually vaginally, but you can also have it rectally. The research shows that most of us have some amount of pelvic organ prolapse. So you probably have a little bit, I probably have a little bit, you probably have a little bit. So don't freak out if you go to a doctor and they tell you that you have one. There's kind of different grades of it, and it's just something that a lot of us do have, and you can be perfectly okay with it, but you do need to learn how to optimize your breathing and not strain through that area. And then our approach to try to remedy that and alleviate it and take the pressure off of the whole situation is to address the pelvic floor dysfunction and the fascia restrictions that may be happening, because inside your pelvic floor you have this tendon, and that is a place where pelvic floor muscles attach. When there is any tightness, you will have tightness on this tendon and in the muscle, which might be giving you the sensation of things pulling down. So if we can alleviate all that, we can potentially diminish your pelvic organ prolapse symptoms.
Perfect.
So that's one sign of
prolapse, feeling of heaviness.
Yes. And then, so the pelvic floor does bladder stuff. So any bladder issues that you might experience would be a symptom of pelvic floor dysfunction, even if you're a man. So if you have trouble starting your urinary stream, it could be because your pelvic floor doesn't open up the gates well. If you have the stress incontinence with laughing, coughing, sneezing, that's the obvious one that most women have heard of. It's less common for a man to have stress incontinence, but they can.
And most women, which is really sad, like I still hear it, even like most days in the gym, like, oh, people are just like, and that's normal. Like they don't even realize, like
jumping jacks.
Yeah, they
know,
say
like,
and I literally said to a patient the other day, like, you don't have to be doing that. You can go see a and like people just, and my mind is blown that people don't know about it.
I know.
I know we live like in this little bubble.
Yeah.
But I'm like, I don't like the fact that, I don't know, there's gotta be more outreach afterwards.
I agree. In our society, women and our needs haven't truly been listened to for decades. It's sort of like you go have a baby and have another baby and don't tell us about your recovery. How's that baby doing? Everything is how's the baby.
And when I went back after
postpartum, like care, recovery, like anything like that.
6 weeks after a twin C-section, they were literally like, and what are you doing for birth control now? That was like the only thing they cared about. And what's your birth control?
You're like,
I want to start crying. What are you talking about? What do you mean?
My birth control is exhausted.
And you can go back to doing all your normal exercises. And I was like,
I know. Yeah, one of the things that we do with people when we're working with them postpartum, and I know you all would do this also, we help them work through their birth story and some of the trauma of it, and how did that unfold, and what is your understanding of what that was, and how might that influence how you use your body or think about your body, and let's do what we can to help you feel more like you. Right. So I have a woman right now who's postpartum who was somewhat tearful last week that she just doesn't feel like herself. She's newly postpartum and she's a little bit upset about the body stuff. I mean, all of us have to come to terms with it. We have more skin and so she and I had like a really great trauma-informed conversation about how does intimacy fit in her life now that she's a new mom and she's upset about this, and she is experiencing lack of arousal and things like that. So we talk about things that she can do from a pelvic floor standpoint, but also from a mind-body standpoint, and from the standpoint of what the research shows that we can do to improve our libido and our responsiveness.
Right.
Because that's where we have our connection with our partners.
Yes, and it's true. It's so hard to be like, I'm not, like the old you just feel like mom.
Yeah, and I think we need to give ourselves the grace to say, like, you know, you're only 11 weeks postpartum. You don't need to be putting the pressure on yourself to be like getting back to your intimate experience.
Yeah, but that is how they make you feel.
Oh yeah.
Like I said, when their first question is, what's your birth control? Because we don't want you popping out a baby too soon.
Yeah, that is true.
Yeah.
But I talk to people about if intimacy is important to you, just give yourself grace for the first 6 months because you're exhausted. And then you might be going back to work at 12 weeks. It's like holy crap.
Yeah.
So give yourself grace. But if it really is important to you, then I do think you need to set a time and a plan for how you're going to introduce that back into your relationship from 6 to 12 months. Because I have definitely worked with people who are like, we haven't had any sex since we had kids and our child is 19 months old. Like now you're really out of the habit and you're afraid to do it.
Yeah, and the last thing you did was birth a child through there.
Yeah,
So
exactly.
I can get it. I remember I was scared to even put a tampon in afterwards because like my cervical checks were so painful.
They're the pits.
Yeah, so
Sometimes.
it was like, so there's a lot of trauma in it, even if you're like, it was supposed to be for birth.
There's
still some trauma involved.
But if that is you and you're feeling quite reluctant or not sure of how to get back to intimacy, high quality pelvic physical therapy will help
you. Wouldn't even think of
that. We will check. So I've only been referring to these internal levator ani muscles, but let me turn this sucker around and look at all these external muscles. So if we took all the skin away, you have these superficial muscles, and these are the ones that get torn when you have a baby. And these can definitely cause pain when you're trying to be intimate. So if you have scar tissue or any trigger points in these muscles, and they're very common, we can very gently treat that and get that to feel better. So the tampons don't hurt and the speculum at the OB doesn't hurt, so that intimacy at the doorway is more comfortable. And if you have trouble with intimacy with deep movements, that often is from these muscles, and we already talked about we can treat that.
Okay, so we have.
So the other thing, so pelvic floor is intimacy, bladder. So that would be the stress incontinence and the trouble opening the trouble getting your stream going, and urgency and frequency. So if you are somebody who says, I have a small bladder,
I have to all the time.
If you come to my physical therapy and say, I have a small bladder, I will say, I don't think you do. The thing is, you've probably trained your bladder capacity to be small, but we can definitely tune up your bladder. And in order to do that, we have to do holistic care. We have to, with all of the care I provide, we're never only treating this. We won't get you better if the treatment is only for this. That's why I work with people for 55-minute appointments, and we're doing care, which is myofascial release, trigger point release, to all the areas that relate to the bladder. So between the shoulder blades, the lower thoracic spine, the lumbar spine, the hips, the inner thighs, the abdominal wall, all of those areas influence how your bladder, which is a muscle, is able to fill up in a relaxed way, hold the urine in a relaxed way, and then contract to pee. So the bladder needs to be able to do all of those things, and we can calm and optimize all that.
Right.
So I tell my patients who have urgency and frequency, like, hey, today you just had a whole TLC experience for your bladder, so please leave this appointment and drink a good amount of water, because I want you to give your bladder now the chance to fill up, hold, and empty in a nice way. It's like we're rebooting it each time, and we're trying to retrain the muscles of the bladder. So we can definitely help that situation. So intimacy, bladder, and then bowel. So your bowel, you know, the second hole is where we have our bowel movements. And I have somebody today whose referral I got who has the problem of when they have a bowel movement, their muscles are not opening, their muscles are closing. So they're trying to have a bowel movement against a closed muscle, and there's constipation and anal fissures and pain and hemorrhoids, and it's the pits. But we can help with that, because all these muscles that go back here need to kind of open and lengthen for the stool to come out, and we can definitely address all of that. In thinking holistically, we also do a ton on the abdominal wall with intestinal massage and looking at like your iliopsoas muscle. I'm sure you guys do a ton with that.
Yeah.
There's a lot of things that are influencing your capacity to have a healthy bowel movement. And if you just don't know how to do that well, even though you think you do, we all think it's normal just to poop, but a lot of times we have learned.
Yeah, people just are like, oh well, this is just it's how I've always been. Like they don't know. People don't know, and they don't know where to go because their doctors, I don't think, even know where to send them.
Yeah.
They give them
Or they're like
mere
laxative.
Yeah. Well, and so I practiced for 20 years in Chicago, and I've done this pelvic health physical therapy for all that time. When I moved here to Grand Rapids, I learned a secret about West Michigan.
We don't talk about these.
West Michigan tends to be very constipated. It is like, no, I'm for real. It's
oh man.
It's very common that I'm working with individuals that are telling me that it is their normal to have a bowel movement every 3 days. And they will say to me, like, really, I go every 3 days, that's normal for me. I'm not uncomfortable, I don't get stomach aches, that's just me. And they have taken it to be normal, which is, that is not healthy, that's not normal. So then I'm talking to
eliminate that stuff.
Yeah, you gotta get rid of that.
You gotta get rid of that.
So I talk to them about a whole myriad things that they can do, from fermented foods and elimination diets and functional medicine. I mean, there's so many things that they need to do, and work on getting your liver healthier. There's just a ton that they need to do. So I provide all this treatment and then guidance and tell them, like, why don't you go see your chiropractor, or why don't you go see this person? Think about addressing it holistically, and you gotta get serious about eliminating the foods that irritate you. Like, I have patients, this person who has the inguinal pain where the obturator bugs her, and she needs a hip replacement. She told me that there's a list of like 7 things that she can't eat. That if she had a plate with all of those things on it, she would be in so much pain afterwards. Her knees would hurt her, her hip would hurt her, her plantar fasciitis would hurt her. But if she only has one of those things like every 3rd day, she's good. And I was like, no! You gotta get rid of all of them, like 100%. You are inflamed, you're in chronic pain. If anyone watching is in chronic pain, you need to know the science shows chronic pain involves an inflammatory reaction. At that point, you have to work on decreasing your inflammation. One way to decrease it is to eliminate all of your known things that your body reacts to food-wise. And then you gotta get your stress under control and your sleep, calm your nervous system. I mean, there's so much that can be done.
But if we've had root functional medicine right there. We've had them on talk about inflammation.
Yeah, they're amazing.
Eliminating the food. Yeah,
they are amazing. Yeah, here in Grand Rapids, root functional medicine can help you with all of that, especially if you have PCOS. They're really good.
Yeah, they're here right now. They work with us.
In the office?
Yeah. Oh, I didn't know that. That's why we keep pointing out.
Like,
oh my gosh.
We've had talking before. Yeah.
So that, it kind of in a nutshell gives you an idea of some of the signs of pelvic floor dysfunction. Any pain with intimacy or SI joint or coccyx or pubic bones or hips, anything like that. Lower abdomen is terrible. Like, I have a patient that I evaluated Monday this week who has a 10-year history of testicular pain. So when you have testicular pain, you're going to go to your doctor, maybe, if you bring it up, and they're going to check you for testicle cancer, and they're going to check you for a sexually transmitted infection, and you're not going to have either of those. And you're going to have this problem. So he's had this problem for 10 years. He's been to a bunch of physicians. He's really upset about it. He's kind of angry at his providers. And anyhow, that individual also has back pain, he has testicular pain, and now he has pain at his sit bones. So my approach would be looking towards all of his pelvic floor and all of the nerves. There's way more than the pudendal nerve, and so I assess and treat all of that. And I've worked with many people who have testicular pain. We can definitely get that better, but it's a little bit of a process.
She does everything. She does everything.
Okay, I have a couple questions. When do you prefer to see moms, like, in the spectrum of pregnancy, like prenatally, during their pregnancy, postnatally, like what does that look like for
During pregnancy, if you have no bladder leakage and you have no pain, then I prefer to see you in your second or third trimester, and we work on birth preparation and teach you how to do breathing
Don't you? Yes.
and opening your pelvic floor so the baby can get through the birth canal. And we go through different positions and any of your concerns.
It's probably super important if babies like breach too.
Yes.
Because a lot of times, or if baby's sitting really high, a lot of times we see that as like your pelvis is really tight, your pelvic floor is probably
That's
really
right.
tight, and that's
Yeah.
why.
A lot of
Yeah.
CrossFitters, a lot of intense workout people. We
Yes.
see have very tight pelvic floors and then difficult labor.
Yeah, we want to keep their pelvic floor easy, and we want their psoas, iliopsoas is
Yes.
a big one for
Yeah.
that as well. And I also check people in that second and third trimester for how is your diastasis recti progressing, because we would expect you to have one in the third trimester. That's normal, but there are things you can do to potentially protect it and not make it as bad.
Here's the thing about, because we know I have one, right? We knew I had one anyway. I always knew I had a C-section. They cut me open. She was, oh, you don't have a diastasis at all. And they just go, what are you talking about? Like, you're cutting me right here. You didn't even like assess anything else.
I know. Yeah, people, diastasis recti.
I was just literally like, even like laying there, all drugged up, like, huh?
You had told me that nobody had checked your DRA the way
Yeah.
I checked it.
Yeah.
Diastasis recti is one of those things that seems to be incompletely assessed.
Yeah.
So when I assess someone, you can tell them,
Yeah.
I am looking at how you can load transfer. So I'm like, what do you do when you're on a plank? What do you
Yeah.
do on a side plank? What do you do when you're rotating? How is
Yeah.
your rib cage moving?
Yeah.
Because remember, the rectus is attaching up to the ribs. So if your ribs are flared, that's going to give you a propensity towards a diastasis recti. And then if a person has a diastasis recti abdominis that is a problem, that means that they cannot load transfer well, and they will see that doming or that caving that
And
happens
they're
on the
like at
abdomen.
risk for like throwing their low backs out.
Yeah, they
Yeah.
are.
Okay.
Yeah,
I've
there's
seen
risk
it
for
happen here.
those things and
Yeah.
other pelvic problems.
Yeah.
But there's so much that can be done. So then postpartum, I like to see people, if they have any large tear, I have advanced training in traumatic perineal tearing and
Okay.
recovery. So that is all this stuff. So if you had an oasis tear, anyone who's watching, if you had it, you know that you had an oasis tear. That type of thing, it puts you at risk for fecal incontinence and other
So
problems.
it's a type 4.
Yeah, 3 and 4. Yeah.
Yeah.
So if you had any of those, then we can do pelvic health physical therapy right away. And you should be getting that right away. I'm finding here in West Michigan, they are not referred to physical therapy as a routine. People tend to be Googling and finding me,
Yeah.
and they're like 9 months out and they really didn't have this. And what happens is there's kind of mental strain because they're having fecal incontinence for 9 months and they're exhausted and they're taking care of a baby and they really didn't have high quality support. But we can definitely address that in a therapeutic and healing way to try to optimize what didn't tear.
And just like here, how you can bring your baby, I've seen people bring babies to your office.
Yeah.
It's not.
Yeah, I love babies.
Yeah.
No,
so
yeah,
like,
bring them.
We know how hard it is to get out of the house with babies sometimes. And you're taking an hour appointment, but like,
Yes.
you're a mom, you get it.
Yeah,
And you're working with pelvic floor.
Oh yeah, it makes my day if
Yeah.
I see babies.
So,
I just love the babies, and especially when they're brand new, they pretty much
Just sleep
in the
there.
car
Yeah,
seat
yeah,
the whole time.
yeah.
So, yeah, it's wonderful. So yeah, you're welcome to bring your kiddos, and everything that I do is in a private treatment room. So I don't really, for this type of care, it's in a comfortable treatment room. So your kiddo would be with us, and you could see your baby at all times, or your little one. No problem with that.
Yeah. I just know some people worry about that. Like, how am I going to get someone for an hour? You know.
Yeah, that's true.
Yeah.
And then postpartum, so we do a diastasis recti abdominis check. If you had no big problems and you have no pain, you might wait the first 6 weeks to come to physical therapy, or maybe you would just get started at 2 weeks or 4 weeks. It depends upon how you're feeling. If you're somebody who postpartum is walking around and you're losing pee walking around, you need to come before 6 weeks. Or you can't pee, you have to come before 6 weeks. We can help you. But then at 6 weeks, if you were to come, we work on the diastasis assessment, the pelvic floor assessment, meaning the superficial tearing stuff and the deep stuff, and then your hips and your back pain, pelvic alignment, your breathing, your rib cage, the whole situation.
You really need a 3-hour appointment.
There's a lot to do, but the appointment would be 1 hour,
Yeah.
and I run on time. And then I have a whole postpartum like recovery progressive program. So there are some guidelines for women to get back to running. So I just talked to a patient today who gave birth about 4 weeks ago, and she is into spinning. So she's back spinning at 4 weeks, and it was my recommendation that maybe that would be a little much for her right now, but it's her choice. I get it. I'm a spinner, so I'm like, oh, I totally know. It's your mental health and your physical health. But
do I know that person? I feel like I might.
you
I think I know her.
You might know her. So
I have a feeling.
my counsel was, if you're spinning, please go to the virtual classes, not the in-person, because I think virtual, she will potentially be a little bit less competitive.
Right.
You know, like you just get going because it's so fun and the music.
Yeah.
So
I love spinning too, so I get it.
yeah, it's fun. But there's a whole, there are all these guidelines that should be met for things like returning to running. So we check all of that. Like, can you do skipping? If you're skipping and you have any pain or any loss of urine, then you're not ready to run. There's different things like that. So we have like a whole checklist. We check it off, and then there's a progressive training program. I can tell you like, hey, work on these things for this week and come back and let's see where you're at and advance you.
Did you have any other questions?
I don't think so.
I have one. Okay, so your big takeaway. What's our big takeaway?
The big
Proper breathing.
I would say the big takeaway.
I'm
is
sitting
that
at home today. I'm listening to you, and I'm like, oh my god.
To
What can I
me-
do to prevent? I haven't had a baby yet. I have no issues, but I want to have a baby. What can I do?
Okay, if you're somebody who's preparing to have
Yeah.
a baby, you can definitely come and get checked and let's see
Okay.
what your pelvic health is like. And let's optimize that to prepare you for the experience of getting pregnant and going through that. I would also check you for a diastasis recti. So your example was somebody who has no problems and wants to get pregnant. It's very unusual for a female athlete to not have pelvic floor dysfunction. For sure. So the research shows that these adolescents, I did a reel on this, 80% of adolescent, their sport was trampolining, so that is their sport. 80% of the young girls, and their average age was 16, they had stress incontinence. And it was multiple sports where the rates of stress incontinence were not 80%, but they were somewhere between like 26% and 80%.
And that's why we think it's so normal.
We do think it's normal. Yeah, I played volleyball in college, and volleyball is one of the sports known to have pelvic floor dysfunction because it's all this jumping, and I was an outside hitter, so I landed always on my left leg.
Yeah.
I was like, boom. And so I had problems, way back when, but I didn't know it.
Yeah.
So it would be my vision that hopefully we can address young girls about their pelvic health when in an appropriate conversation to speak to what is normal and not normal. If you're a mom and you have a young lady who's in high school sports who is having any stress incontinence, first you'd want to ask her, and then second, if she is experiencing that, we should get started with some care. And for young people, we don't have to be doing the internal work. It's just too much for them, I think.
Yeah.
So there's so much we can do just external only.
All right, yay. Thanks for coming.
I love being with you too. Your space is beautiful. Anyone who hasn't been here, come here and get your treatment. It's beautiful, and they have a parking lot right in back, so it's super easy to park.
Yeah. We'll have you come back. Be more.
Oh my gosh.
I love this. Thank you so much for
Also,
having
I
me.
just want to point out, I just realized I'm wearing my Valsalva bear down. This is my girls who powerlift bear
That's
down.
awesome.
Bear down is the name of the sweatshirt.
Oh my gosh,
So,
yeah.
That was funny since we were talking about this. I didn't even think
There's
about it.
different memes on there of the CrossFitters having incontinence. You've probably seen them.
I don't, so I'm just kidding. I mean, I don't, but I'm gonna come see you anyways, probably.
Yeah, I would love to see you.
Best.
If anyone has any questions, you can call my office, Purple Mountain Physical Therapy, 616-516-4334, or follow me on Instagram at Purple Mountain PT, or Facebook, Purple Mountain Physical Therapy. And I'm just in Cascade, so pretty close to the I-96 and Cascade Road exit.
Super close.
Thanks to these
Okay.
two.
Yeah.
This
We'll
is fun.
We'll tag you on all our social